Hi, everybody. My name is Jeanette Perez. I am going to be presenting psychedelics usage in therapy and the therapeutic sort of purposes clinicians can have in it. First and foremost, we are going to go over the different kinds of psychedelics. The classic psychedelics are the four: LSD, psilocybin, also known as mushrooms, mescaline, which is also known as peyote, and then DMT, which is known as ayahuasca. Some newer psychedelics that are available now and have been created are MDMA, ketamine, and ibogaine. So these are the kind of the psychedelics I'm going to be talking about. I'm going to leave out some psychedelics with more abusive properties, such as PCP. However, these around 7 have been used in a lot more recent clinical trials, and also were kind of researched back in the 60s as well. So the psychedelic effects that people can have during a trip is increased heart rate, nausea, intensified sensory experiences, kind of like this background, changes in sense of time, so time moves differently for them. They experience dry mouth, so kind of like cotton balls in your mouth, sleep problems, a lot of the time they stay awake. They have a spiritual experience when they are on these psychedelic drugs. They also experience a sense of relaxation. And simultaneously, they are also excessively sweating. Sometimes there's a bit of panic or paranoia with increased body temperature, hallucinations, coordination, or loss of coordination, memory loss, and some weight loss. Yeah, so those are some of the effects that they have. For the toxicity rate, initially, it was reported that they had really low risks of toxicity. However, with the criminalization of psychedelics, there was a lot of unfounded concern and claims about genetic and chromosomal damage that could be happening due to the psychedelics in the body. However, there was a lot of evidence that reported that there was no evidence to say that that was the case. It didn't cause any long-term genetic or chromosomal damage. Psychedelics don't have that ability, or hallucinogens. There is also no evidence that it is toxic to mammalian organ systems, so humans or other mammals, as long as it's in normal doses and with the classic psychedelics, which is sort of the first 4 that we talked about earlier: the LSD, the psilocybin, the peyote, and the ayahuasca. Although some newer psychedelics have higher levels of toxicity, and that's more like PCP and MDMA, but that's also researched a lot as well, and I will go over that in a little bit. I'm going to go over the history of psychedelics because I think it's super important to discuss and understand. So, and there's the religious purposes, LSD creation, the criminalization, and then the fight against the criminalization. So we started using as humans, not like we as in this classroom, because that would be strange. It's been used for over 5,000 years. They've been able to carbon date peyote buttons from 3,780 BC. And there is a lot of evidence that there was a lot of psilocybin mushrooms used in ancient Mexico, so los Aztecas and los Mayans. However, due to colonialism, Roman Catholic missionaries who deemed it to be sort of inappropriate for their religious purposes eliminated and destroyed all records of it. So we don't have an exact date or can date back to that. The research and stuff, back in 1943, Albert Hofmann discovered LSD by accident and experimented on himself with what he thought was an extremely low dosage, but he was actually taking double the dose. Fun story. After his super spiritual and amazing experience, he made it freely available for research purposes. So he just like sent out what his discoveries and was just hoping to get more understanding of why he experienced that and why it happened. So there was a huge interest in using psychedelics like LSD and mushrooms in treating mental disorders up until the 1970s, which is, lo and behold, criminalization of the psychedelics. So in 1973, Richard Nixon created the Drug Enforcement Agency, or the DEA, and psychedelics, along with a lot of other substances like marijuana, were placed under Schedule 1, meaning to them that it was super dangerous, it was super addictive, even though the research didn't really support it back then. It was more of a political move. And so 34 other countries also agreed to ban psychedelics too, and they were under the UN. So when that happened, all of the research funding for psychedelics just completely dried up, which was really, really disheartening because there was a lot of good research being discovered back in the 60s for a lot of mental health disorders. So sort of like the night and day was even that you can see here in Life magazine, that in 57, they were talking about how mushrooms is cool, new, strange thing and interesting. And then now in 1966, they're pushing the criminalization, and now they're explaining it as a threat that gets out of control. So it's scarier and kind of adding propaganda to it. As a result, there was an organization called the Multidisciplinary Association for Psychedelic Studies, or MAPS for short, that was created in order to try to bring psychedelics and also marijuana research to allow them to research it and their effects on people. So they are currently a 501c3, so it's tax deductible if you donate to them, and they're doing tons of research on this. And they have really interesting values. I checked out their website. I was very, very happily surprised and impressed by it and how accountable they are, which is part of their value system that I've listed. So overall treatment, in 1967, there was the largest study at the time that had been done before the ban of psychedelics on non-psychotic patients. Very specific, they were not experiencing psychosis, and that group had 243 patients, and 81% of them were noted to had significantly improve after treatment with LSD. And the research in the 60s and 70s really focused on non-psychotic patients with mental health problems. However, what they also discovered is that there were very poor effects with schizophrenic groups or psychotic groups of individuals in treatment. And sometimes it may trigger hallucination or some of their already exacerbated symptoms. So meet Tony. Tony is a U.S. veteran with PTSD. He currently, or at the time of this, he uses opioids for pain, and he was chosen to participate in an MDMA research trial sponsored by MAPS. And we're going to hear a little bit more about him right here after my technical savvy figures this out.
During Tony's first MDMA session, he lay on the couch, he had eye shades on, he listened to music, and he would speak to the therapists, who were a male-female co-therapy team, whenever he felt that he needed to. After several hours, in a moment of calmness and clarity, Tony shared that he had realized that his PTSD was a way of connecting him to his friends. It was a way of honoring the memory of his friends who had died. But he was able to shift and see himself through the eyes of his dead friends. And he realized that they would not want him to suffer, to squander his life. They would want him to live more fully, which they were unable to do. And so he realized that there was a new way to honor their memory, which was to live as fully as possible. He also realized that he was telling himself a story, that he was taking opiates for pain, but actually he realized he was taking them for escape. And so he decided he didn't need the opiates anymore, he didn't need the MDMA anymore, and he was dropping out of the study. That was 7 years ago. Tony is still free of PTSD, has never returned to opiates, and is helping others less fortunate than himself in Cambodia.
So there's Tony's success story as being a participant in this research that has been going on. Oh no. So we are going, there we go. So currently there is a lot of research being done for substance use treatments using psychedelics. So in alcohol, there is promising, mixed but promising results, where a meta-analysis back in the 60s and 70s showed that people were able to maintain sobriety for 1 to 3 months after treatment. However, it was not sustained 6 months after treatment. But that still shows promise, because that's a significant number. So as there's also, as you heard, Tony also stopped using opioids. And there's also been research done for opioid medication, or opioid substance use disorders, using psychedelics. So ibogaine is a very specific psychedelic that was made, or is from Africa. And here the research has been done in Mexico and New Zealand. And what they discovered is ibogaine is good for opioid detoxification. And the effects lasted after 12 months, or 12 months after treatment, which is super impressive. And this was on a population that had histories of treatment failures. So they had tried other treatments and were not successful. So this shows a lot of promise. There's also a lot of research done about tobacco and tobacco cessation, and using psilocybin, which is mushrooms, 2 to 3 doses, along with cognitive behavioral therapy. 80% of participants were able to be abstinent 6 months after treatment, and 60% stayed abstinent about 57 months after treatment. That's 4.75 years. So 4 years, almost 5 years after treatment, they were able to stay abstinent. Yeah, those participants also had less severe withdrawal symptoms after using psychedelics compared to previous quitting attempts. And then they also say that it was mediated, or the mechanism is mediated by spiritual experience that really changed their priorities, values, and improved their emotional regulation. Another very, very prominent field of study is using psychedelics for post-traumatic stress disorder. So they're in research. I'm only doing there's a lot of research for this, but I'm only focusing on 2 main studies. MDMA was given, or a placebo was given to a control group in 2 to 3 8-hour sessions. And then for 3 90-minute sessions, they were given 3 90-minute sessions after each dosage of MDMA or the placebo. And what they saw was there was greater reductions in scores in the MDMA group than the control group. And after 2 sessions, like 54.2% of the MDMA group participants no longer met criteria for PTSD, compared to 22.6% of the group receiving the placebo. And they would see that there was substantial changes in their depressive mood index. And here they use the BDI too. So that was more recent. That was in 2019. So last year. So cool. And on top of that, there were no major adverse effects. So no real intoxication. Well, they might have been intoxicated with the MDMA, but there was no negative effects, no withdrawal symptoms, no long-term damage, and they were okay. Second, and I'm pretty sure this is the group that Tony was in. Then there was also another research done for MDMA with a focus more on post-traumatic growth, which I thought was interesting because that includes positive changes in your self-perception, positive changes in your interpersonal relationships, and positive changes in your philosophy on life, and just like being more positive in general, growing as a person. So that hadn't been researched before this study, which is in 2020. Go figure. So 60% or 60 participants with PTSD who had not responded to previous treatments were in this study. And the MDMA group, or the group that received MDMA compared to the placebo group, had larger reductions in symptom severity, which shows the same from the previous one. But not only that, 2/3 no longer met criteria for PTSD at the end of the study, as well as they also had post-traumatic growth. So those 2/3 had an increased self-perception, increase in interpersonal relationships, and an increase of philosophy of life. And this is after having gone through other treatments in the past, like CBT treatments, to try to improve. The research is just phenomenally interesting, and especially for a substance that was criminalized and so heavily pushed away from us. So I thought that was super interesting. Here is a quote I think is really important, and it's important to see psychedelics as a tool rather than and a powerful tool at that, but instead of like the end all be all. You're using this as a tool to improve your psychotherapy. And here the quote is, "Naturally, the tools of this power carry with them greater risks than more conservative and far less effective tools currently accepted and used by mainstream psychiatry, such as verbal psychotherapy or tranquilizing medication." So I think what's really powerful with this is we need to learn how to be able to use psychedelics as tools, especially kind of almost honoring ancient tradition and ancient religions, where at that point they always had kind of guides and a guide to do so, or to take them on the journey after having consumed psychedelics. So the way I see it, or I sort of can understand it, is that they're doing the same thing here. We're using these tools and bringing it to the mainstream and bringing it back as something that's not scary. Rather, it's something that we can use to help heal. So it's some food for thought, something that's coming up, and something that there potentially could be training in if you get involved with the organization MAPS. So I hope you enjoy my presentation, and I will talk to you guys later.